So, hi everyone, and welcome to today's webinar. Thank you so much for joining. My name is Rosie, and I'm an examinations administrator here at the Ophthalmology Foundation. Just as a short overview, the Ophthalmology Foundation is a charity that has been in progress for the last 5 years, and its mission is to eradicate unnecessary blindness throughout the world, especially in under-resourced countries, through education. With that in mind, we offer a wide variety of different educational programs, including our examinations, which we are here to speak to you about today, as well as our fellowship program, which Cordula will speak to you about as well today. Um, it's very much a global organization. We have a board made up of members throughout the world, as well as our examinations committee, again, with members across the globe. And we are looking forward to just telling you a bit more about our examinations and how we can support you in your journey with us as you move through our different educational programs. So before we begin, it would just be great if everyone could please introduce themselves. So I'll start with Nicola.
Thank you, Rosie. My name is Nicola Quilter, and I'm the Examinations Director for the Ophthalmology Foundation.
Thank you. And Cordula.
So my name is Cordula. Hello, everybody, and I am in charge of the UFFOF Fellowship Program. Thank you.
Thank you. And Dr. Hamdi.
Hello everyone, I'm Dr. Hamdi, the head of ophthalmology, of the ophthalmology department at Ibn Haytham Hospital, and I'm the coordinator in Jordan.
Thank you. And then finally, Vicky.
Everyone, my name is Vicky and I'm an examinations administrator for the Ophthalmology Foundation.
Thank you. So we have some presentations for you all today. But once we have completed all of three of the presentations from each of our panelists, we will have time at the end for Q&A session. A lot of you have submitted questions upon application for this webinar, so thank you very much for that. But if you have any questions throughout the course, there is a Q&A box at the bottom of your screen, and at the end we will take the time to answer any questions people may have. So I will hand things over to you, Nicola, who is going to share a presentation on our examinations. Thank you.
Thank you, Rosie. So good day and thank you for joining us. Today I'm pleased to introduce you to the Ophthalmology Foundation International Examinations, which are internationally recognised standardised assessments designed to support excellence, consistency in ophthalmology worldwide. These examinations are delivered across the world, allowing candidates from many regions to access the same high-quality assessment. Wherever a candidate trains or practices, the standard remains exactly the same. At the heart, these online exams assess knowledge across the whole breadth of ophthalmology. They provide a reliable and meaningful way to benchmark performance locally, nationally, and internationally. The fees are based on the World Bank Index, meaning that they are low cost compared to any other international examination. And there's a 3-way and a 6-way payment plan to also support you in your application. The examinations are aligned to the BCSE. There's alignment to international standards. All questions are mapped to the American Academy of Ophthalmology Basic and Clinical Sciences course, and it covers the full breadth of ophthalmology training. This ensures consistency, relevance, and global comparability. Regularly reviewed, updated in line with the BCSE developments. So each question is looked at by our panel, and each examination paper goes through a rigorous process of up to 30 specialists review. The Examinations Executive Committee. So our the oversight of the exams is provided by an experienced international executive committee. This ensures strong governance, academic integrity, and continuous review. So Louise Meyer, who is chair of the exams, is actually originates from Colombia, but is now based in the UK. And then you've got Richard Bowman, Rebecca Ford, who are responsible for our exam papers, along with Carl Dolnick, who is head of our education, Bertold Seitz, who is head of the fellowships. The examinations framework is carefully structured into 3 sections, and together these reflect the progression from scientific foundation through optics to comprehensive clinical practice. So we have basic science, optics, refraction and instruments, and clinical ophthalmology. Visual sciences consists of 120 single best answer questions completed over a 3-hour period. Topics include anatomy, genetics, pharmacology, and ophthalmic pathology. So here's an example question, and I'd just like to say that we are testing knowledge. We are not testing the use of the English language. So you'll notice that our questions, how we're asking the question, is quite repetitive. So this one is regarding the blood-retina barrier, which one, so we're looking for one correct answer, of the following statements is most likely to be true. You'll also see from A to D that the answers or the possible answers are listed alphabetically. And this also means that if you bypass the question because you're unsure and go back, you can have some kind of recall. Again, not testing the English language, but testing your knowledge. The optics and refraction and instruments paper is 60 single best answer questions over a 1.5 hour period. And they're optics, refraction, and instruments, which are equally weighted with 20 questions in each subject. Here's another example of the type of question we ask. And again, quite repetitive. So which one? So we're looking for one correct answer again. Is the following is the orientation of the streak of light when performing retinoscopy for astigmatism. Again, A to D is set alphabetically. The clinical ophthalmology exam is the largest section of the exams. It includes 160 questions over a 4 hours period, spanning all major ophthalmic subspecialties, including neuro-ophthalmology, orbit, uveitis, cataract, community, and public health. There is also a small section on general medicine related to ophthalmology. And because our examination is online, this allows us to use photographs, charts, and videos. And you'll notice that the question is actually more clinically asked. So as you see here, so we have a photograph and the question is referring to the photograph. Again, A to D, the possible answers are listed in alphabetical order. To support you in preparing for the exams, we offer practice questions that are available through the website. And again, they're free of charge, so you can access them now and kind of get a feel about the type of questions we're asking, the standard and the format. We also have suggested reading lists, which are aligned to the examination content, access to high quality educational materials, and we're currently working with CyberSite for a dedicated portal for the examinations. And again, that will be free of charge. There'll be roughly 250 questions in each subsection. So exemptions. Candidates have already demonstrated the competency through recognised international exams may be granted exemption from the visual sciences and optics and refraction. So that includes the International Council of Ophthalmology, if you have been successful before and including 2022, the COEXA examinations, and also the Royal College examinations, including the Royal College of Ophthalmologists, the Royal College of Physicians and Surgeons of Glasgow, and the Royal College of Edinburgh. As I mentioned before, we're not testing your language competency, we're testing knowledge. So to further support accessibility, the Ophthalmology Foundation examinations are translated into several languages. And these include Chinese, English, French, Portuguese, Spanish, and Vietnamese. And equally, if there was a request for another language that's not listed, then we would obviously look into that. All examination questions are written by international subject experts. Each question undergoes meticulous review to ensure clarity, relevance, and consistency. So they're regularly reviewed and updated, and they are high academic and clinical relevance. The examinations are criterion referenced and standardized using an Angoff method. This supports fairness and enables meaningful comparison of outcomes across the regions and institutes. And what this means is that we have a pool of experienced ophthalmologists that review each question and give that question a value. And what that means is the pass mark is set prior to you taking the exam, which means if you all reach the pass mark, you're all successful. But equally, if you don't reach the pass mark, then you will be unsuccessful. Development is strengthened through collaboration and leading international institutions. With alignment to establish ophthalmic education, we work with Wills Eye Hospital and Wilmot Eye Institute. We're aligned with the AAO Basic Science, and we're also working currently with the Royal Physicians and Surgeons of Glasgow, and we hope to be able to announce that in the coming days. Our delivery is modern, it's secure, and it's reliable. Candidates can sit an examination at approved centres with in-person invigilation and remote AI-based monitoring. This allows us to monitor your eye movement, screen movement, and check in real time the candidate's performance. Taken together, this approach reflects the principles that guide Ophthalmology Foundation exams. They are modern in their delivery, efficient in their design, and affordable when compared to similar international examinations. This ensures high quality standards remain accessible without compromising academic rigor and clinical relevance. Examination sessions are held twice a year, in March and September. Results are released promptly within 2 weeks of the exams date. And it's credit to Rosie and Vicky. We say 2 weeks, but actually we released the results for the March exam within 6 days. We understand that this is an additional exam, there's pressure, did I pass, was I successful? And so we believe reducing that level of stress, we try to release the results as soon as possible. So why take our examinations? And this is a question we get asked quite a lot. The examinations provide internationally recognised certification. They offer a cost-effective way to demonstrate your knowledge and benchmark your performance against your peers globally. Candidates are awarded FIOF, becoming a fellow of the International Ophthalmology Foundation, and also you gain points towards an IOF fellowship. In turn, we believe that achieving the pass enhances the quality of patient care worldwide. Awards and recognition. So excellence is recognised through the David and Molly Pyatt Travel Award. A $10,000 award is presented to the highest performing candidate over the 2 clinical sittings. I was lucky enough to call the successful trainee this year, or for last year's exams. They were from Ethiopia, or studied in Ethiopia and taking the exam in Rwanda. And they were going to use their $10,000 award for a fellowship. So candidates consistently describing the exam as fair, clinically relevant, and well developed. And this gentleman is bridging every known barrier and accessibility and affordability. So again, our fees are reduced based on the World Bank Index. Many highlight the clarity of the questions and the reliability of the platform. So actually, it's a smooth process from application to result. So you can go on via our website, you can apply for the exam, make payment for the exam, upload your photo and documents, and then also receive your results through the platform. This is a gentleman from Namibia. He says it's a smooth experience start to finish. So we also have 2 new initiatives. We've established a global ambassador committee to create a network of passionate advocates who will help raise awareness of our exams and our educational opportunities. By working together with ophthalmologists around the world, we aim to strengthen local engagement, build meaningful partnerships, and expand access to high-quality ophthalmic education for future generations. We're also launching a new partner spotlight series, which will regularly feature one of our partner organisations across the Ophthalmology Foundation communication channels. Each spotlight will showcase the organisation educational activities, achievements, and contributions of ophthalmology, giving them greater visibility within our global community. It's another way of recognising the value of our partners whilst helping others learn about the excellent work taking place around the world. So once you move through the exam process, you also have the opportunity to become part of a global community. And then further down in your career, when you maybe you're running your own department, you have the opportunity for faculty development, accreditation, and partner spotlight series. So future developments, the exams are criterion reference, as I said, and we're also going to put the same process in place for subspecialty exams. So we're starting to run retina and glaucoma from March 2027, and then we will be adding an additional 4 exams for subspecialty in September 2027. We're working with the Royal College of Physicians and Surgeons in Glasgow on a reciprocal agreement. And that means if you take some of our exams, you'll be exempt from elements of theirs and vice versa. And we're also working with Cordula and Bertel Sites on the IOF fellowships, where it will be a prerequisite to have passed one of these exams to enable you to apply for one of the fellowship. So this is our last slide. As I said, we're modern, efficient, and affordable. QR code is there for anyone that'd like further information. We're also on social media, Facebook, Instagram, LinkedIn, and YouTube. And you can pop a question in the box and hopefully we'll cover it later. But also reach out to us if you think of something. Post this presentation via email. We're also on WhatsApp, so you can join the global community via WhatsApp where you'll receive information. So thank you for your time today. It's been a pleasure to talk to you. We warmly invite you to register for the upcoming exams. The next one is in September, and form part of our global community. Many thanks.
Great. Thank you so much for that, Nicola. Just to reiterate, if anyone has any questions after that presentation, please feel free to drop them in the Q&A box below and we will answer them at the end of this session. Dr. Hamdi, if you would like to share your presentation.
Actually, I haven't prepared a presentation since I guess most of my colleagues already know Ibn al-Haytham Hospital. We're now the center for the examination, and we'll be holding the exam in September at Ibn al-Haytham Hospital. If there's any questions, my number is readily available, and I'm always more than happy to share my thoughts with you and to help in any way possible.
Great. Thank you so much, Dr. Hamdi. Thank you. Cordula, if you would like to share your presentation about our fellowships. Thank you. You should be able to share your screen. I have added you as a co-host.
Okay, can you see it? Is it there?
Yeah, showing now.
Can you see it?
Yeah, you can.
Okay, so thank you very much for inviting me to speak to you today. As I said, my name is Cordula. I'm in charge of the EOFF-OF Subspecialty Fellowship Program, and I'll give you a short overview of it. So EOFF actually stands for International Ophthalmological Fellowship Foundation. We are a German charity that was founded in 2007, and we are committed to enhancing eye care education and eye care delivery in low-resource and underserved countries. Our program invites highly motivated young ophthalmologists from low-resource and underserved countries to apply with us for 3 months, a 6 months, or a 1-year EOFF or subspecialty fellowship, which they can serve at an international teaching center. These are mainly university eye clinics or big tertiary centers with an education department. Immediately after having completed the EOFF-OF subspecialty fellowship, our candidates return to their home countries, resume their position, and take part in programs to preserve vision and prevent blindness. The majority of our fellowships is actually classified as observership. However, there is an exception which applies to our host institutions in India, in Bangladesh, and in China, and to training in surgical subspecialties as cataract, glaucoma, and oculoplastic. Our candidates can obtain a temporary recognition of their specialist degree from the ministries of health in these countries, and are then allowed to practice and to perform surgeries and have a clinical experience with patients. Our program does not offer a degree and it has no curriculum. The reason for this is that the educational level in our target countries is very, very differing. And so the idea of our program is actually bringing everybody from his level of knowledge to a higher level of knowledge. This goes through individual support with which personal skills in eye care are enhanced, and we want our candidates to focus on challenges in their daily work. So it will not be possible to learn all about vitreoretina in 3 months, but if you have a specific challenge that comes up in your daily work on a regular basis, then this can be helped. So how many awards do we have per year? For the 3 months fellowship, we have around 100 awards per year. with a maximum grant of 5,000 euros or 6,000 US dollars. This depends a little bit on who the sponsor is. Then we have the 6-month fellowship in collaboration with the Eye Cancer Foundation from New York. It's 6 awards per year with a grant amounting to 8,000 US dollars. So these fellowships are actually being served in countries with a higher prevalence of retinoblastoma, because in many Western countries there's hardly any retinoblastoma because of the screening programs. In collaboration with the Retina Research Foundation, we offer a clinical 1-year fellowship with 2 awards per year and a grant of 35,000 US dollars. And in collaboration with the AOI, with the Academia Ophthalmologica Internationalis, we offer a 1-year research fellowship for somebody who has an ongoing research project and wants to continue this in a laboratory or in a university center somewhere abroad from where he or she lives. So this award goes with a grant of 12,000 US dollars. Our grants are supposed to help cover expenses for round-trip travel, accommodation, and visa costs and miscellaneous expenses. And if somebody has higher expenses, then we expect this person to actually cover from his own means or her own means. So on this slide, you can see where we have host centers. We have currently 103 host centers in around 30 countries. Since we are a European or German initiative, we have a very strong representation in Europe and in Germany especially, but we also have a lot of host centers in the US, in Latin America, some centers in Africa, in Turkey, Iran, in India, Nepal, and Australia, and some Asian countries. This is a slide about the international awareness of our program. The countries that are marked in red actually are the countries where we only have host centers. The countries that are marked in yellow are the countries where we have candidates from. And we have some countries like India, Bangladesh, Brazil, where we actually have host institutions, but we also have candidates from. These countries are marked in red and black. So what are the most popular host countries? Actually, a lot of fellows actually go to India because they can enjoy some surgical training in cataract, for example. Then we have a lot of fellows actually going to the US, to UK, and to Germany. These are by far the most popular host countries. What are the most popular subspecialties? We have, actually, it is cataract surgery, which is still #1 cause of blindness in the world. Then it's glaucoma, pediatric ophthalmology, cornea, oculoplastic, vitreoretina, and medical retina. But we also have the not so popular but very important subspecialties, and that is very good. A quick mark: we do not support training in refractive surgery, and we do not support training in aesthetic surgery in oculoplastic, because we are convinced that these types of surgery are not meeting the needs of the poor people in low resource and underserved countries. So this is about the eligibility process. We are looking for candidates who hold nationally off and are permanently based in a low resource underserved country. Ideally, our candidates are 40 years of age at the time of submitting their application file. They have completed their residency training and have obtained a specialist in ophthalmology degree. Our candidates come with a strong recommendation from their previous and their present chair. Previous chair can also be the residency director. And ideally, our candidates come from a public services or a teaching position. Of course, our candidates are committed to resume their position after the training to apply the newly acquired skills and knowledge. And as I've mentioned before, we ask our candidates to have a very clear idea of what aspects in their subspecialty they wish to focus on. So we have questions in the application file called "What is your motivation to apply with us? What is your expectation for a training? And how do you want to implement the newly acquired skills and knowledge into your daily practice in your home clinic?" And these three questions, the answers to these three questions are crucial for us. And if a candidate's answer is a little weak, then I will encourage this person to consider well and explain in detail. As Nicola mentioned before, the Ophthalmology Foundation examinations find strong consideration in our assessment. And from September 2027 onwards, the Ophthalmology Foundation examinations will be mandatory requirement, as Nicola mentioned. And if you've got any questions regarding reciprocity, then please feel free to reach out to me or to my colleagues from the Ophthalmology Foundation, and we'll help you with this. The application process is relatively simple. Information on the program is available on our website. There you will find an online registration form in English, French, Spanish, and Portuguese language, and with an upload section for requested documents. The requested documents will be a specialist degree, will be a confirmation that the candidate has completed residency training. It will be the passport, a scan of the passport. It will be the Ophthalmology Foundation examination certificate, if available, and it will be 2 recommendation letters from previous and present chair. Also here, I would like to point out the importance of the answers regarding motivation, expectation, impacts to gain. This is really crucial. After eligibility confirmation from our side, the candidate may choose and contact his favorite host from the EOFF host network. I'll show you later. Then usually our hosts or preceptors will invite for a short interview and will propose a start date. Then the host can decide and will return the duly signed host notice of acceptance form to the candidate and to me. And then the application file will be complete and we will process it for experts review and funding decision. So what are the next application deadlines? These will be February 28, 2027 and August 31st, 2027. Actually, there is still an open application deadline until July 31st, 2026, but it's very close to that deadline and usually it takes longer to really finally complete the application file. Again, we consider the Ophthalmology Foundation examinations and we strongly recommend taking them. So this is a screenshot from our host network. The network is searchable by country, by city, by host institution, by host's name, by subspecialty, and by duration. And you can, here on the right-hand side, you can type in, for example, subspecialty or choose it from the drop-down menu, and then you will get your answers. You will get appropriate suggestions regarding host institution offering the subspecialty. If you click on the host institution, this is a link, then you'll get access to our backend where we have a detailed sheet on the host institution, on every of the host institute, with contact person's name, with host's name, with host institution's details, some details on the clinic, and on what subspecialties actually the clinic is offering, who will be preceptor, contact person of these, and if the training could be classified as an observership and the duration of the training. So it's always worth taking a look on these sheets. We are very grateful and we are very happy about those who take the Ophthalmology Foundation examinations, because we think it's a strong passport, knowledge passport for those who sit them, and you can compare your standards to the standards of your international colleagues. So we are congratulating and recognizing those of our candidates who have set the Ophthalmology Foundation exams, and Dr. Newma, Dr. Baba, and Dr. Albishari are awardees from this year's application batch, and we are happy to congratulate them for the award. Special congratulations also go to Dr. Gipri Kidan from Ethiopia or Rwanda, who has passed the prestigious David and Molly Foundation Travel Grant, and he is currently preparing an application for a one-year program with us. We also have an experience section on our website, and you can find some pictures of our awardees and some statements of how they have liked or not liked their experience in the host institutions, and you are invited to read it through and get yourself an idea of the program. Who is supporting our program financially? We are grateful for our multiple sponsors from international and German industry, as well as from international and German foundations, and also ophthalmological societies are supporting our program with funding, and this is very good, so that we have a very broad basis of funding for our fellowship program. Okay, here are our contact data. Rosie usually publishes the email addresses of all the panelists from today's webinar in the note section on Zoom. She is nodding, so she'll do it. And so thank you very much for your attention, and please feel free to reach out to me if you've got any questions. Thank you very much. I stop sharing my screen now.
Thank you so much, Cordula. Thank you very much. If you don't mind staying on, as I'm sure we'll have a couple of questions for you as well now. Thank you. So we will now move into our Q&A session. So Vicky, if you could run that, please, and share the questions. Thank you.
Thank you, Rosie. The first question we have is, can a candidate take the clinical exam first and then the basic and optics? For Nicola.
No, there's a pathway that you need to follow. So you need to take the visual and the optics, and most trainees take those together on the same sitting, and then once successful, move on to your clinical. You are able to take the clinical with optics or visual, for example, if you were not successful, but you should start with visual and optics unless you have an exemption.
Thank you. Do we supply study material?
As I said, you can go onto the OF website. We have suggested reading lists, books, webinar videos, etc. We have practice questions that give you some kind of idea of the format and the quality of questions. And then we're also working with CyberSite to have a dedicated portal with about 250 questions from each of the subspecialties that you can practice, and it will tell you if you've got the answer correct or incorrect, etc. So that will be available in the coming weeks.
Thank you very much. What is the study plan? So when would you suggest the candidate begins to study for the exam?
So the application process for September closes at the end of July. So we recommend that we believe that is enough time to prepare for the examination. Don't forget, these exams are based on what you should be practicing every day, learning part of your normal training process and clinical practice. So you're preparing anyway, generally, but obviously we believe that around the first week of August is probably the limit for preparing for an exam. And I would say, be realistic. Make sure that you've got enough time, you've got commitments of home and a social life, etc., children, family. So make sure that you are able to set enough time aside. So plan realistically.
Thank you very much. The next question we have is for Cordula. Is there an age limit for the fellowship program?
So actually, ideally, our candidates are under 40 at the time of completing or of submitting the application file to us. However, we are a little flexible when it comes to the age limit, as we are more interested in finding good candidates for the program than rather those who are just under 40 years of age. Yes, but as an orientation, it will be 40. Thank you.
Thank you, Cordula. The next question we have is for Nicola. What is the difference between this exam and the ICO exams?
Our exam's better. It's modern, efficient, it's online, it's much lower cost. We're accessible, so we find you an exam centre locally, as you don't have to travel, you don't have the stress of travel or expense. A lot of the we can guarantee our standard of exam as well, because we have a lot of specialists that migrated over from the ICO a couple of years ago, that produced the quality of our exam papers. It's standard set to the highest level, and we also, we're offering roughly 100 fellowships a year. And so what that does is it gives you a better opportunity to move through our system and hopefully be successful. We've got a great team of faculty development, accreditation, we've got the global network, we've got the Spotlight series, the material online. So it's definitely worth exploring. As I say, we have a payment plan as well, which you can spread the cost over 3 months or 6-month period. So yes, what we're offering is high quality and low cost.
Thank you very much. The next question is, what is the path with the subspecialty exams? Do they have to complete all of our exams to then go on to subspecialty, or is there an exemption policy?
So we offer FIOF on successful completion of the clinical exam. If you move through that process, so if you're a junior trainee and you're starting at the beginning, you move through that process and you're awarded FIOF, you can then move on to subspecialty exam. And if successful in retina, for example, you'll be able to use FIOF retina. However, we do recognise that there are senior ophthalmologists who would like to take a subspecialty exam who will not necessarily move through our process. So we'll have an exemption policy based on what you're actually doing currently. So if you're if you've been training, or if you've been working independently, as a retina specialist, for example, for the last 5 years, then we may consider your application for direct application to retina. But that will be discretionary and you'll have to meet a criteria. But there are 2 pathways. But if you're successful through that pathway and haven't passed the clinical exam, you will not be able to use FIOF retina. You will gain a certificate in competency of retina.
Thank you very much. The next question we have is for Cordula. If a candidate wishes to submit an application for a fellowship, do they have to find a host centre prior to applying, or can they find one through you?
So actually, we are offering a multiple number or a good number of host centers in all subspecialties and in our EOFF OF host network. And however, if somebody has already a very established relation to a host center that is not on our list, he or she may just send me an email and we'll find a way of supporting this application as well.
Thank you very much.
And yes, it is first online registration and uploading of documents. Then comes eligibility confirmation, and only then our candidates will choose and contact their favorite host, one host at a time.
Thank you very much,
Thank you.
Cordula. The next question we have is for Nicola. Is there an expiration date on the certificate? So if a candidate was to take visual and then leave it a couple of years, would the certificate expire?
No, so there's no expiration date on any of our examinations, and equally there's not a limit on how many times you can resit. Obviously, we want you to be successful, so that's why we provide the questions online and prep tours, etc., to help support you through the process. But if you are unsuccessful, then you can apply straight away for the next exam, for the reset of the exam, or subsequently, if you want to leave it a few years, then we'll accept another application. So there's no expiration date.
Thank you very much. The next question we have is for Cordula. Are the fellowships fully funded?
So actually, we are offering a lump amount, which can be spent as needed. And if candidates cannot cover their expenses with the amount funded, then he or she will have to cover extra expenses by own means.
Thank you very much. The next question we have is for Rosie. Do you have the fees for the Jordan community, please?
Yes, so our basic science is $250. The optics, refraction, and instruments examination is $175, and then the clinical ophthalmology examination is $350. I will put that in the chat as well for everyone.
Thank you very much. That is all the questions that we have, but Rosie will put all the contact information in the box for everybody if you have any questions.
Thank you very
Thank
much,
you, everyone.
Vicky. Thank you.
Thank
I'm
you.
just going to post our contact details in the chat box. So thank you so much, everyone, for joining today. It's been wonderful getting to speak to you about our examinations, and we hope to hear from you soon about starting our examinations program. I'm just going to put the fees back in there. And if you do have any questions, please feel free to contact us. We also have our social media. So if you look up Ophthalmology Foundation across all platforms, you'll find us there. And we'll get back to you with any questions that you may have. So thank you all very much again, and we look forward to hearing from you soon. Thank you.
Thank you.
Thank you,
Bye.
everyone.
Bye.
Take care.
Thank you. Bye bye.